Hi, my name is Tony Owhadi. I am the Senior Director for Environmental Services here at Mount Sinai Hospital main campus. So terminal cleaning is an intensive labor process for disinfecting all patient rooms on daily basis. It's a process that involves frontline staff, and we can talk more in detail what it is, and it normally takes about 1 to 2 hours per room. So we do mechanical cleaning on a daily basis. So we use a healthcare grade hospital disinfectant, which is hydrogen peroxide and bleach that gets used on daily and multiple times per day. And on top of that, once the rooms are thermally cleaned, we come back with ATP tests. This is to find if there's any additional germs on the surfaces of high touch areas. So we validate with ATP testing. And after ATP testing, we use the UV technology to UV the room. And once the room is done and is validated, we come back, we do an additional QA, which is quality assurance with the management team, to make sure all high touch areas in the room have been thermally cleaned before the room is turned over for the next patient use. So the process takes between 1 to 2 hours per room. And this whole process, keep in mind, the room gets thermally cleaned from ceilings to floors. Curtains come down, all rolling stocks are taken out of the room, and everything permanent in the rooms are all thermally cleaned top to bottom. And it's done by our frontline staff, and it's followed up by the operation managers who go into the room to inspect the room, make sure it's done properly and safely. No, the entire hospital gets thermally cleaned on a daily basis. In addition, we have additional staff every day that are assigned to high-touch areas such as doorknobs, elevator lobbies, where they disinfect these and clean up on a daily basis on a 24-hour cycle. We want to make sure the whole environment is kept clean, not just patient units. So again, Mount Sinai Health System, the EVS department task is to keep a safe environment for faculty, staff, and patients. With that being said, we ask everyone to use safe, proper hand hygiene by disinfecting and washing their hands, using the proper receptacles for any type of waste. By doing this, we all could have a safe and healthy environment for all our staff and faculties and patients to be.